Well, I spent a little time reviewing your records,
Great.
so it took some time. Let me explain the nature of this evaluation. It's called an independent medical exam. I don't know if you've ever had one, but even if you have, let me explain the format from my standpoint.
Sure.
This is really just an assessment, and the reason I characterize it that way is that there's no doctor-patient relationship. There's no treatment involved, even though I have a active practice at Beaumont that takes care of these kinds of complaints where I do treat patients. This is not considered a treating situation. I've read some records. The evaluation will consist of a formal history. I'm going to take a history of your incident, workup, treatment, and the like. I'm going to do a clinical exam. Any part of the evaluation that you don't want done, that it bothers you, I'm not here to make jackknife you or make you feel worse leaving than you did coming in. Just let me know. We'll hold off. Then, after that's all said and done, I will author a report that will include all the things we're talking about, and it's sent to whoever sent you here. Since there's no doctor-patient relationship, I'm not involved in your care. In an independent medical exam, no matter whether your attorney sends you to one or anybody sends you to one, there's no part of the format where we discuss, hey doc, what do you think about this, that, or the other thing. It's not that anybody's being rude, it's just not part of these kind of formats. Okay, so I was asked to evaluate, and it only had a general term of back. So, in reviewing your workup, treatment, and your areas of complaint, there's nowhere in there that it really involves necessarily your low back. It seems to be mostly your thoracic spine. Is that correct?
Yes, sir.
Okay. And if there are low back complaints, you just need to tell me, but I'm going to only go to the areas that are your area of complaint. So let's talk about your current complaints. Before we get into what happened and what your treatment has been, what are your current complaints?
I don't sleep well. I haven't since injury. My ribs continue to pop out of place depending on the activities throughout my day.
What else?
Um,
Now, usually there's pain associated with it, so
yes, severe.
why don't I go to pain? And instead of giving a severe or mild or moderate, the way we like to do it is on a 10 scale. There's no such thing as 20 or 30 or 15 pain, but 0 being the least and 10 being the most. How would you characterize the pain?
Are you talking about just everyday functioning?
You can do it any way you want. You could
do
do it at rest. You could do it during activities.
Okay, I'm functioning daily at a 6.
So 6/10 constant.
Constant. When I've been doing physical therapy 2 to 3 times a week, I am functioning around an 8.
Okay, and then when the rib pops out?
100.
There's no such thing as 100. Okay. What about medications? Are you on any medications for this?
No, I can't take pain medication. Makes me really sick to my stomach.
Okay, was there a time they put you on medicine, or has it always made you sick that you were never on medicine?
It's always made me sick, never on medicine. I did, however, last summer get my medical marijuana license.
Okay.
So cannabis has been somewhat of a help as far as the pain.
When did you start that?
I want to say August of 2017.
Okay. Now, even though you haven't had any medications, has there been any other form of treatment, such as injection therapy?
Yes, sir.
What was that?
Immediately following the injury, Bloomfield sent me to their doctor, who was giving me injections.
Okay, so let's hold off on that. Let me get that in the treatment. I'm going to go back. Okay, I was just curious if you would have said no injections. I could have just said no injections. But since it's part of your treatment, I'm going to go over that.
Sure.
Okay. So you have difficulty sleeping. You have these varying levels of pain depending on what happens. You're currently in therapy, but you're not on any medications, correct?
Correct.
Okay. Okay, so my understanding is, and I have a date of injury, sometimes it's not the date, but it's a 10/11 of 16. Does that sound correct?
Yes.
Okay. And you were lifting a student in a wheelchair, correct?
Correct.
Okay, and then you experienced immediate pain, correct?
Correct.
Now, after you experienced this immediate pain, and you said that you went to a workman's comp, either clinic or doctor, whatever it is that the only initial treatment, or did you have an intervening emergency room treatment?
No, that was
Okay.
the first treatment.
Did you ever go to the emergency room for this?
No, just,
Okay.
well, if you consider Bloomfield's, I think they're considered like a emergency room,
Well, let me ask you this.
not hospital.
Where you saw these industrial clinic people, was it like in an emergency room or urgent care setting?
Urgent
Is that
care.
what you're saying?
Urgent care.
Okay. That's where you saw them, or did you see them, did you go to the urgent care separate from the workman's comp people? Or you just saw them in the urgent care setting?
Yes, where
Okay.
Bloomfield sent me to.
Okay. So you were sent to the urgent care, but anytime you were evaluated through Broomfield Schools, it was through the same facility, right?
Correct.
Okay, so what was the length of time you saw them? You started in October of 2016. Was there some point where you stopped seeing them and saw somebody else?
Yes, I seen them through January
Of 1/7.
of 17.
Okay, okay. And what was the treatment that was done there during that time frame for that 3 months?
Physical therapy.
So you had PT.
Mhm.
What else? You mentioned some injections.
That wasn't, well, they gave me injections for pain
Okay.
in my rump.
Okay, other than those kinds of injections, have you had any other type of injection therapy?
With a new doctor.
Okay, we'll get to that then.
Mhm.
So between October of 16 and January 17, you had therapy, you did have some pain shots. Any other treatment?
No other treatment. The physical therapist at that time discharged me from continuing treatment there because I wasn't improving. I was only getting
Okay.
worse.
Okay, so because you weren't getting better, regardless of whoever said it, you did seek some additional treatment after that, correct? You were having continued symptoms, correct?
Correct. That were worsening actually.
Okay, getting worse. And then who did you see after that?
Dr. Leininger. He was a PNR doctor.
And how did you get to Dr. Leininger? Who was the one that referred you there?
My family practice doctor, Dr. Matthew Kulik.
Okay. So you also, I'm assuming, well, it's possible you could have just called up Dr. Kulik, but did you actually see Dr. Kulik and he said you need to see somebody else?
Yes, sir.
Were you seeing Dr. Kulik at the same time you were seeing the urgent care of Bloomfield, or did you not start seeing him until after you decided that you were having symptoms but you wanted more treatment?
Bloomfield told me I could only see their doctors until I heard otherwise, that I was allowed to seek treatment
Okay,
through my
and
own.
then once you were allowed to seek treatment after so many days, that's
for
when you
so
saw
many
Dr.
months.
For so many months, well, say 90 days or 100 days or whatever. After so many months, I think it's actually in days, I think it's 100 days, but
Okay.
in any event, that's when you started to see Dr. Kulik. You weren't also seeing Dr. Kulik at the same time, okay? So after the time frame, once you were allowed to see somebody for a workman's comp injury, you saw Dr. Kulik.
Mhm.
Okay, so let me make sure I understand one other thing. during the time frame from 10/11/16 until January, until you saw Dr. Kulik, what was your work status at that time?
I was working full-time with restrictions.
And what were the restrictions?
No lifting, pushing, pulling.
Okay, so if I have those records, they'll probably be in there what they were.
Yes, sir.
Okay. Um, Let me just ask a general question. Now, it says here that your last day of work was 2018 in this year.
Correct.
Okay. From the time this occurred in October of 2016 until January of 2018, did you always work, or were you on and off work depending, or did you always work with restrictions?
Do you want me to give you the specific timeline?
Just a general timeline first.
Okay.
Were there times where you didn't work?
Yes.
Okay.
When I went on short-term disability.
Okay, so we'll just get to that. If you would have just said I always worked and I was on restrictions, then I would stop there, but I need to get more specifics. Okay, so at least up until you saw Dr. Kulik, you'd been working with the restrictions that you're talking about, correct? Okay. Then you saw Dr. Kulik, and did Dr. Kulik do any particular treatment, or just said you need to see PMR? Were there some other things that were done first?
No, we went to see PMR.
Okay.
And at that time I moved to half days working with restrictions.
Okay. So meaning you went from full-time to half-time. And Dr. Kulik did that, or Dr. Leninger did that?
Bloomfield doctors.
Okay.
The urgent care.
Okay, so you weren't getting better, let's put it this way, you weren't getting better and they went into half-time. Okay, now you've had, I think, 2 MRIs of your thoracic spine, correct? Have there been more than 2 or just 2?
I just had a third one.
When was that?
At McLaren, that was August, the beginning of August.
Of this year?
Yes, sir.
Okay. Before we, so let me ask you this, who ordered that one?
That was Dr. Nalamathu.
Okay. Now, I know you've had 2 other MRIs before that. Did you have one MRI initially through Bloomfield at the urgent care, correct?
Yes.
And then where was the second one ordered through?
Dr. Kulik.
Okay. Was that before you saw Dr. Leininger, or it could have been any time?
It was before. I believe it was. I'm almost certain it was before I went to see Dr. Leininger.
Okay, so then what was the treatment under Dr. Leininger?
Steroid injections.
Okay, so you had some steroid injections. You know what kind, where they were, or what kind they were?
They were in my thoracic spine.
Okay. And then, how long did you treat with Dr. Leininger?
Just about 2.5 months, 2.5, 3 months.
Okay. Now, what was your work history at that point, either through Dr. Kulik or Dr. Leininger? I mean, let me ask you this. Did it change? Is that when you went on short-term disability, or was that later?
Yes. In March of 2017 is when I went on short-term disability. As
Okay, hang on a second. I need to write this down. Okay, so let's see. You treated with Dr. Leininger for 2.5 to 3 months. You started seeing Dr. Leininger after January. So was it Dr. Leininger or Dr. Kulik that put you on short-term disability?
Bloomfield Home Schools.
Okay. Okay, so after you stopped treating with Dr. Leininger, then who started treating you?
Dr. Kulik.
Okay, so when you left Dr. Leninger, and Dr. Leninger did some injections, what did Dr. Leninger say after the injection treatment?
He said that it wasn't, this wasn't going to be a good fit for me as the, the number scale that they go by as far as improving and pain and what that is all about, the PMNR doctor's pain management. And because it wasn't benefiting me in a substantial number, that this is not a good treatment for me.
So he
and
said,
if I continued to get injections in my spine, that's going to increase my risk for further injury. And
okay, so
quality of life is most important, and he recommended that with this injury and his best recommendation was to try to rest and allow it to heal on its own.
okay, so Dr. Leninger said that the injections weren't helping the way that you wanted them to, basically, right?
That he was hoping that they would.
Well, did they help?
No.
Okay, so you had no help from the injections.
No.
Right? And because you had no help from the injections, Dr. Leninger says, well, we're not going to do any more injections for whatever the reason. Okay? Okay. And he did some other recommendations of letting it heal and resting and all that kind of stuff, right? Okay, so then you went back to Dr. Kulik, right? And then what was the treatment with Dr. Kulik?
It was just, I was on short-term disability. So that was to continue physical therapy.
Okay, so you started short-term disability, you said, in March of 2017.
Correct.
Okay. Now, between March of 2017 and your last day there of January 11, 2018, did you ever physically return to work?
Yes.
Okay, and when was that?
That was October of 2017.
And what were your restrictions at that time?
They were the same.
Okay. And did you continue to work from October of 2017 until your last day of work, or were you on and off during that period as well?
I continued to work. I was off a couple days. My pain level was functioning at a 10 daily.
Okay, hang on a second. Okay, now during this time frame, when you returned to work in October of 2017, and you said you had a few days off here and there, and you continued to work at a pain level of 2018. Before you returned to work, and you were seeing Dr. Kulik, and after you had the injections that didn't help and you went back to him, what treatment did you have? Were you just in therapy?
I was just in therapy, and in August, Dr. Kulik and I were, considering maybe trying to see, how things were healing and what can we do moving forward. So I got another MRI. In that week span, Bloomfield, the same time last year, received a letter from Bloomfield. They wanted to send me for an evaluation, like we're doing right now, to a doctor who basically said I wasn't disabled, and Bloomfield wanted me to go back to work working with this same student who I endured the injury with. And Dr. Kulik was like, we just got the results back from your MRI. It's abnormal. I would not recommend that you go back to work with that same student. If you want to try to go back to work, we can write you back with restrictions.
Okay, so you got another MRI in August of 2017.
Yes.
You had an IME.
In the MRI, let me clarify this. In that MRI in August of 2017, it showed that the fracture in my ribs was healed. That was in the very first MRI. That was healed, but the disc was still bulging the same size as date of injury.
Okay. Okay. I have the reports of the MRIs. Okay, so but your understanding of the MRI, let's put it this way. Your understanding was that there was a fractured rib that healed and a bulging disc.
Yes.
Okay. Okay, you had the IME, and the IME doctor recommended return to work. Okay, no restrictions.
Yes.
Dr. Kulik had a different opinion and gave you a return to work with restrictions, right? And according to what you said, even though this was in August when you had all this stuff, you actually returned to work in October with restrictions.
Yeah, well, it's like September, like, you know, you get the letters in the mail and then this is your
Okay.
scheduled appointment.
Okay, I understand.
Yeah.
Okay, so September, October, you had the return to work, same restrictions, and then you continued until January of 2018. Question is that, were you still in therapy at this time, or were you under no treatment at this time?
No treatment.
Okay, no treatment.
Mm-mm.
Only treatment basically is restrictions.
Yeah.
Okay.
And really just the functioning day to day, the activity, the constantly moving, like that was enough to, you know, put my pain level at.
You told me it was 10 over 10.
Yeah, so I mean,
Okay.
physical therapy in itself alone, that not working, that's at keeping me at an 8. Working every day was at a 10. So
Okay,
no
okay.
sleep.
I understand that.
Yeah.
Okay, so then now we're in January of 2018. Okay. At some point in time, you've seen Dr. Nalamuthu, right?
Mm-hmm.
And when did that start?
Dr. Nalamathu, that started this summer. So,
And how did you get to Dr. Nalamuthu?
through Dr. Kulik.
Okay, so between January and the summer of 2018, you're seeing Dr. Kulik, correct?
Mm-hmm.
Because you didn't see Dr. Nalamuthu until the summer of 2018.
Mm-hmm.
What was your treatment between January and the summer? Just more therapy or nothing?
Yes, physical therapy.
Okay,
Mm-hmm.
so you continued on therapy.
Yes.
You see Dr. Nalamuthu, and you said you had a recent MRI.
Yes.
Okay, and what's your understanding of the most recent MRI?
He wants me to go see an OMN specialist.
OMN?
Yes, I believe so.
Okay. And what is the OMN specialist supposed to do?
Just basically strategically plan, hopefully for quality of life, what kind of things I can do to prevent my ribs from popping out of place, as well as is it possible to try to, my ribs on the left side are sticking, like they healed basically forward, so day to day it's like I have pain in my spine depending on the activity, so yeah.
Okay, so your understanding of the MRI, let me make sure I understand that, is that the ribs have not healed where they're supposed to be. Is that what you've been told?
Yeah, that's what my understanding is from, I mean, physically you can feel it, you can see it, so.
I'm not so much what you can feel right now, but what Dr. Nalamuthu has told you about the MRI, your understanding, that the ribs have healed in an abnormal position?
Yeah, and he doesn't know, that's not his area of expertise.
Okay, other than sending you to an OMN specialist, did he recommend surgery?
He said I was not a candidate for surgery.
Or do you still see him, or you just saw him the one and he said go to the OMN specialist?
I was seeing him twice and.
Okay. You saw him once before the MRI, once after the MRI.
Correct.
Okay. Out of any and all of other doctors that you've seen, have there been any doctors that have recommended surgery?
No.
Okay.
He said that the pros and cons are to be weighed in this kind of situation, considering my age, the location of the injury, which is essentially under my rib cage and my thoracic back.
Okay, but that being said, there's been no specific recommendation for operative intervention.
No, they were definitely trying to seek other
Okay, okay.
routes.
It sounds like they said to avoid surgery.
Yes, referred to every time they said that was my age.
Okay, okay. So other than all the doctors that we've talked about, have you seen any other surgical, either rib, back, or spine specialists?
No.
Okay. 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 What about driving?
It sucks.
I mean, are you able to drive? Did you drive today?
Yes.
Okay, one other question. I think I'm getting close to the evaluation, but I'm gonna go over your forms first. Any other prior similar problems to this from that day?
What?
Any other prior similar problems like this prior to the 10/11/2016 in terms of these complaints?
No.
Never had a prior complaint, right?
No.
Okay. Okay, so even though these are filled out, I'm assuming, I can't assume anything, but there's no indication of who filled the forms out. That's blank. So is that, you were told to not sign anything?
Yes.
Were you also told not to say who filled them out?
He told me, my attorney advised me not to sign any paperwork.
Okay, I understand that, but were you also advised to say, I didn't fill these out?
No.
So did you fill them out, or do you not want to talk about that?
I guess I'm not gonna talk about
Okay.
that.
So,
I'm not
So,
sure, so.
no, I mean, whenever I see forms, I don't know if someone was out there with you filling them out. I don't know if you filled them out, but at this point in time, you don't want to talk about who filled the forms out, that's all.
Well, I filled the forms out because I'm the only one here, but.
Well, no, I mean, like I said, I don't know who was out there with you. Somebody could have filled them out.
Nobody filled them out.
Okay. That's all. I mean, it's not a trick question. I mean,
Okay, I didn't know
some
if it
people,
was.
some people just say, my attorney said not to fill out the forms, and that's all I'm going to say, even though the forms are filled out. And that's fine too. I mean, it's fine.
So I shouldn't be filling out the forms. I thought he just said not to sign anything.
That's between you and your attorney. I have no idea. You know, I mean, what your attorney told you to or not to do. Some people don't fill out forms. Some people give me 6 pages of forms. So some people come in with like the United States Constitution of forms that their attorney helped them, construct. So everybody's different. Okay. So let me kind of explain where we're at now. I think I have a history of your evaluation, workup and treatment, your current treating doctors. You wrote down what you did at work. I do have a lot of treating records. I don't have any of Dr. Malamuth's treating records. At this point in time, I think I'm ready to do the exam. If there's any part of the exam that's uncomfortable, please let me know. If there's something you want to add to the history at any point, feel free to add something in the history. If I overlook something or something like that. Okay. Maybe we'll have a seat up here. Start with that, if you can do that.
Yeah, I just stand because it's
More comfortable?
less pressure and more comfortable.
Okay. Okay. Can I move this out of the way?
Sure.
I'm just gonna start with some reflexes down below.
Mhm.
What? Okay, we're gonna do some strength testing. I'm gonna go up and down, okay?
Mhm.
Push out. Push out as hard as you can, okay? Pull back. Push out. Pull back. Feet up towards your face. Don't let me push them down. Push down. Okay. Bring your knee up here. Knee up here. Okay, now I haven't seen anywhere where you've had any complaints of any numbness, tingling, or lack of feeling in the lower extremities.
Thank you for bringing that up. So when I first started physical therapy through Bloomfield, PT, I started experiencing, sciatica, which
Okay.
I never had experienced that before, where my whole leg was going numb and
Mm-hmm.
tingling, very cold.
Okay, what about currently?
Currently, no. Sometimes, like this hip up here, this hip on the left side, it gets tingly and like numb in my arm, but that's not, it's not every day.
Mm-hmm.
And definitely a lot of weakness in this left arm, like trying to use a can opener. I can't grip the.
Okay, but today, talking about today,
Mhm.
you actually have feeling here.
Yeah.
Same thing with the hands?
Mhm.
Not dead, numb, anything like that, correct?
No.
Okay. Let's work on the upper extremities now. Okay. Arms above your head, high as you can go. Arms out in front of you. Push out. Push in. Okay. Arms up towards you. Don't let me pull them out. Push towards me. Squeeze my fingers hard as you can, okay? Relax. Push out. And push in. Okay. I want you to quarter this way and show me specifically where in your back it bothers you.
It's like right here.
So it's all in that upper left area.
Mm-hmm. And it's like this, depending on how far these like protrude forward, it makes the spine hurt really bad when
Turn
these
this way
are
a little
sticking
bit. I'm
out.
going to do some pressure on the back here.
Mhm.
So you start coming down, it's in this area here,
It's
correct?
tender, very
Not so
tender.
much down here though.
No.
Okay. Sit back up. I'm going to do some reflexes up top. And we'll be just about done. Do you get numbness or tingling that radiates around your chest?
Sometimes.
What area?
Same spot where the ribs is from the thoracic down. It's more like it's like a throbbing. For example, like if I'm trying to like in physical therapy for building my strength and muscles, which is what they say is better to help the back to heal quicker. But it's almost like my ribs are like threatening me, where I know like they start throbbing really bad and they become tingly, and I like know that means I need to like stop because they're gonna
Okay.
pop out of place.
Let's try range of motion of your neck. Chin
Okay.
to chest, chin to shoulder, chin to other shoulder. Let me see you stand up. What about bending down and touching your toes? Is it something you can do or prefer not to do or don't do?
I try not to do it.
Okay.
I can. Through physical therapy since January, I've been
Mhm.
working really hard 3 times a week.
I mean, do what you feel comfortable, or if you don't feel you want to do it, that's
I
fine
don't
too.
wanna do
Okay. Up on your tiptoes?
Mhm.
Up on your heels? Okay. Actually, from my standpoint, I'm pretty much done with my exam. You're free to go.
Okay. Thank you.
Mhm.